With this, we move on to the next lecture. And this will be by Dr. Jacqueline Shahar. And she's going to talk to us about the benefits of exercise in obesity management. She's a clinical exercise physiologist and a diabetes care and educational specialist at Joslin Diabetes Center at Boston. She started her career as a fitness combat trainer in the Defense Forces and developed the exercise curriculum for the Joslin Weight Management Y Weight program. Deliver groups and one-on-one exercise sessions for patients with diabetes. And she consults with patients with type 1 and type 2 diabetes and pre-diabetes on a comprehensive exercise plan to improve diabetes control, promote weight loss, preserve muscle mass, correct muscle imbalance, and improve athletic performance for more than 20 years now. So I think she's really the best person to tell us about what an exercise plan should be like for obesity management. Over to you, Jacqueline.
Thank you so much for inviting me for this special conference. I'm really excited to be here and talk a lot about exercise. It's my passion. I'm going to share my screen and get started. Okay, are you able to see my screen? Am I good to go?
We can see.
All right, perfect. Thank you. All right. So I'm going to talk about balanced exercise plan for obesity management. So our learning objectives state level of physical inactivity and barriers to exercise. We're going to define sarcopenia, the impact on diabetes control and the connection. We understand the components of a comprehensive exercise program. We're going to get into the details, and then how do we apply different exercise training and specific exercise that's going to work for this target population. So first is just quickly, we know most people know these, the World Health Organization physical activity guidelines, which is important for us when we are going to talk about the training. It's important for anyone to exercise at least 150 minutes per week at moderate intensity, or even get to 300 minutes when they want to lose weight. Those who are doing vigorous exercise can do a minimum of 75 minutes or even more, 150 minutes to a week. It's extremely important to perform strengthening resistance training exercise at least 2 days a week or even more on non-consecutive days. And the biggest piece is really we want to limit a sedentary lifestyle and incorporate some leisure activity throughout the day as much as possible. So with the problem with the physical inactivity, or the fact that people are sedentary, this had been identified as the fourth leading risk factor for global mortality, which is about 6% of death globally. And it's a major problem. So people with diabetes tend to be less active than those without diabetes. They spend 65 to 75% of their wake time in sedentary lifestyle. So reclining, sitting, watching TV. So this is where the problem is. Being sedentary definitely cause a lot of the changes, the metabolic change that we have to take into consideration. This is just additional research around that. So more than 50% do not follow the physical activity guidelines. 40% perform less than 10 minutes of physical activity at moderate to high intensity. And of course, there are major barriers. Number one barrier is lack of time. We know it's for everyone. Lack of time makes it difficult to fit in exercise, especially when we think about 30 minutes in a row. But I'll share with you some research on breaking down some of the time to fit in exercise easily. Additionally, work and family commitments, medical issues, lack of motivation, fear of injury, weather condition. There probably are a lot more that may come when people try to fit in exercise in their lifestyle and find it challenging and difficult. And then on top of those barriers and the fact that people are sedentary, have to deal with sarcopenia. And so that's age-related muscle loss. So this is basically start approximately from age 40, and it will decrease, muscle mass decrease over the years. On top of that, there could be some scenarios of catabolic crisis. So for example, acute illness, so being hospitalized, being in bed rest, and then maybe not recovering well. During that time, people lose significant amount of muscle mass, which make it more difficult to get back on track with their exercise and staying active. And it's really different for them. So it makes it more challenging to get on a plan, and they become less and less active over the years. So try to get into more the details would relate to the sarcopenia. We know it's age-associated muscle loss, and that lead to muscles function and strength decrease. So people, again, very sedentary, their metabolic rate decrease significantly, adipose tissue increase, it creates more glucose intolerance, and that is a vicious cycle, and then continues over the years and makes it more challenging over time. But then there is the connection with obesity, and this is kind of a vicious triangle between diabetes, sarcopenia, obesity, and that lead to sarcopenic obesity, and that's characterized by high fat mass, low quality muscle. You can see a healthy muscle compared to sarcopenia. It creates insulin resistance and inflammation in the body, and basically muscle mass decrease, and again makes it more challenging for these people to stay active and engage in a good exercise program. And what we found is that it's actually worse among people who are undiagnosed. So having that high inflammation, high blood glucose, and definitely cause more breakdown of the muscle tissue, and as well as those who have diabetes complications as well. They will have more accelerated pace of that muscle.
God.
So now let's get into the exercise. So there are so many ways. The good news is exercise can do a lot. I like to call exercise medicine by itself, because we could see significant changes in our body. And so when we think about, so I'm going to actually move this away. I apologize. Do you see that top screen? Is just a second here. Sorry about that. Go back to here. All right, very good. So now we're looking at the benefits of exercise, and specifically a combination of aerobic with resistance training. So we have improvements in cardiorespiratory function and increase in mitochondrial biogenesis. So there is increase in production of the ATP. With resistance training, there is increase in hypertrophy, and overall we see increase in the GLUT4, so more glucose getting into the cells. Glycogen synthesis increases as well. We have more ability to store glycogens, and in terms of acutely, when muscles are contracting, there is this glucose uptake that occurs 24 to 48 hours afterwards. And that is terrific when we basically looking at overall glucose control. It can improve as people exercising at least every other day, not to mention even every day when they're trying to lose weight. So when we think about a comprehensive exercise program, that will include all of these components. So resistance exercise, which we also call strength exercise, aerobic cardio, working on improving endurance. We want to work on balance and flexibility. And every exercise program should start with a warm-up and finish up with a cool down. And we're going to get into more details. So I want to spend a lot of time around the resistance training, because this is a piece that seemed to be the most difficult for our patients. although I like to show them this slide and talk about how resistance training can bring so many benefits in terms of improving their heart function. So it's not just the cardiovascular exercise that can improve the heart function or endurance and overall cardiovascular system. It's also resistance training. They can feel better after we get the release of those endorphins. Of course, we're going to improve the glucose, changing lipids and decrease fat, decrease inflammation, improve blood pressure, circulation. Of course, the bonus is increasing muscle mass for those who are able to, or potentially preserve their muscle that they still have, increase energy expenditure, bone density improves, and cell hydration improve as well. So there's so many benefits to resistance training that we have to think about how do we fit it into their lifestyle, because it's easy to put on the shoes and go for a walk, but it's not as easy when we think about all kinds of exercise with different movements that need to be done. So I like to give patients general important tips that we're going to address. But when we meet one-on-one, of course, anyone who going to be exercising, especially in the Y-Weight program, that I'll talk more into details in a few minutes, they need ophthalmology and PCP or cardiology clearance. Some of them may need a stress test, but I'm not going to get into that. That's not part of this topic of the conversation for our presentation. We definitely want to discuss safety with exercise in presence of diabetes complications. So some of them may have retinopathy or some other issues, autonomic neuropathy or some other problems, and we have to modify their exercise plan. We want them to wear proper shoes. A lot of them have plantar fasciitis, the arches collapse. So this is definitely make it more challenging when their gait is a little off, and then they may have more pain in the hip, knee, or ankle. So we definitely need to address any muscle and joint issues. Part of the Y-Weight program, we perform the 6-minute walk test. It's a great test to measure exercise capacity. In this test, they walk. We have a long hallway on the floor where they're walking for 6 minutes. Then we measure their oxygen, we track their oxygen, and also the heart rate recovery. And then we compare it before and after. We see the changes. A lot of them, of course, improve their exercise capacity significantly. We also measure their waist and hip circumferences as part of this program as well. So in terms of specific consideration for resistance training, so it's a key, as I mentioned before, warm-up, performing a dynamic warm-up, incorporating static stretchings, especially when the muscles are warm, so you don't have a tear of those muscle fibers. We want them to follow periodization training. What does it mean? So we're working initially on endurance of the muscle, working at high repetitions. And then we progress over the course of our program into muscle strength. So they may start with 15 reps, 1 to 2 sets. They're going to progress to 3 to 4 sets of each exercise that they're going to be doing. And so we're kind of working in a pyramid type training where they will start with 12 reps. So that would be a lighter weight. As they cut down the number of repetitions, they are increasing the weight or the resistance of bands that we use to stimulate the muscles, because that's really a key component to basically we're trying to apply the principle of progressive overload. This whole process occurs over several months. And of course, it's based on ability of our patients, because some of them have ability to progress faster, as other people may be progressing at a slower pace. We might initially start with a full body workout 2 to 3 days a week. So what it means, I'm going to work those major muscle groups. I'm going to work on my back, my chest, my shoulder, arms, legs, core, the core, the trunk, the And that's a key component in every exercise program. So we're looking to kind of get that basic resistance training and get them the basic strength. And then as they become more efficient with their exercise and more proficient, so they are able to do more like of a split routine where they're going to be working upper body muscles 2 days a week, and then lower body muscles and core 2 days a week. And basically we're doing that split, but we're challenging those specific muscles more often with more resistance, with more stimulation to see better benefits and more muscle hypertrophy and strength over time. So when it comes to the intensity of the exercise, so we use the RPE, the rating of perceived exertion scale, which we know that is a subjective measure. Especially, it's great for those who take beta blocker. We know that will slow down the heart rate. So we want them to go by how they feel. So based on their physical sensation. So if their heart rate is increased, their breathing frequency change, and how if they're sweating or they get fatigued. And that's really important for us to go with. And that actually correlates very well with their heart rate. So initially, we want them to start with a warm-up when they are able to breathe deeper, comfortable. That's part of the warm-up and the cool down. Then they're going to be increasing the intensity of whatever type of exercise they're going to be doing. If it's on an elliptical machine or a bike or a treadmill or a rowing machine. So we want them to go a little faster. So they're going to be breathing harder. It may be difficult to hold a conversation. And also we're going to incorporate some interval training, which we're going to get in just a moment, and basically pushing them for a very short period of time to that level where they work really hard, but then bring it back to like a recovery pace, and then able to do that several times in a row. So this is basically referred to the interval training, which is great to improve endurance, insulin sensitivity, ability to increase glucose uptake by the muscles for so many hours after the workout. So always start with a warm-up. Then there is this pace that they go fast. For one person, it might be a jog. For another person, it would be just walk up on an incline. On the treadmill. For someone else, they can apply it on a bike. A lot of people feel like biking on a stationary bike may not give them much, but then when we apply interval training, they actually find it extremely useful, and they're feeling like they're working much harder so they can see great results. So that can occur with the recovery periods between each of those intervals where they work really hard. And that's, again, subjective for how they feel like they can push themselves. And of course, we finish up with a cool down. So this can be applied indoor on any machine, outdoor, and they can use interval timer. And that's a great timer that can be downloaded into the phone. And it actually doesn't interfere with, let's say, if they want to listen to music. So they can hear a beep to start the interval. They hear beeps to stop, and then they will be able to continue that ongoing basis until they are ready to cool down. So this is an interesting meta-analysis that I wanted to share. Just was published last year about the effect of accumulated short bouts of exercise on weight and obesity. So that was in that meta-analysis, there were about 18 studies that were included. And basically what they were looking at, what were those interventions? And what they found is that the interventions that range from 3 to 6 days a week, from 60 to 200 minutes per week, 6 to 25 minutes, and 2 to 8 times per day were actually were very useful. So within that range, they were able to get significant improvements in waist circumferences, in BMI, body fat percent, and that's when they were exercising accumulated 150 minutes or more per week. So this is important for us to understand, especially when we know that lack of time is a major barrier for everyone. Let's implement this great strategy where people can exercise 10 minutes in the morning, 10 minutes in the afternoon, and then they can even add more, even a minimum of 6 minutes that can be as beneficial to see improvements in the weight. And overall, what they found is in that meta-analysis that interventions that were 10 weeks or longer were more effective in improving those obesity indices. So that's really something that we have to implement as much as possible. And we do that also in the Y-Weight program. So now let's get into the specifics of the Y-Weight exercise progression plan. So I try to put as much as I can in this table here. So our intervention is for 12 weeks, and I broke it down to 3 parts, where the frequency of exercise initially is 3 to 4 days a week, where they work more light to moderate intensity. Of course, they all get to follow the RPE scale, and they may exercise 20 minutes, but even within the 20 minutes, the minimum, they can break it down to 2 sessions of 10 minutes or even less than that, as long as they get the accumulated time of 20 minutes minimum at the start. We incorporate different types of exercise, and I'm going to get into more details about that. And then when you see here the resistance training, so initially we start with 1 day a week, we go to 2 to 3 days a week, and then we progress to 3 to 4 days a week as we are in the third part of that program. You can see that also the duration of the exercise increase pretty gradually. So again, we are looking to have them adopt this new active lifestyle. So it's not anything too extreme that they cannot, that it's difficult for them to apply. When it comes to the types of exercise, so I feel like, we should be training them like we're training athletes, but just at a different intensity. We want them to implement different types of training. If we think about just learning the basics of resistance training, doing unilateral versus bilateral training. So for example, if they're doing a squat, so they might be pushing with both legs, getting up, that we're doing a chair squat, or maybe we could have them do like a single leg squat. So they're working only just one leg at a time separately. So each leg going to be working, because sometimes it can happen where one leg is more dominant, one arm is more dominant in strength. So we want to make sure that we are kind of correcting that imbalance. We work on core stability, and that's really important to fit in. And I'm going to also show you some of those exercises in a few slides. So basically, the goal is to work on the stabilization of the hips, because a lot of the times is the weak core can lead to hip problem, lower back problem, knee problem. So we want to work specifically the glute muscles, the transverse abdominis, those are the deep abdominal muscles. We incorporate circuit training in addition to intervals. We incorporate some balance exercises. Of course, we're doing the stretching, either dynamic or static stretching. We incorporate some yoga movements as well. So there are different types of training that are incorporated. Also superset training. So that's a key type of training where we're working. So for example, we're working agonist and antagonist. So we're going to work on the biceps, but then we also want to work on the triceps. We're going to work on chest muscles, but we make sure that we work on the back muscles. So we do those opposites as part of the routine. So they're learning a lot of those basics with regard to performing the exercises correctly, which will reduce the chance of getting injured. So in terms of the exercise equipment, there are many ways for them to do their exercise. So it doesn't mean going to a gym, especially during this time, that going to a gym may not be safe. So our first and top priority is actually using resistance bands with a door anchor. So what's important here is that they have this door anchor that attached to the bands and that allows them to work all those different muscle groups. Okay, some of them might be using some free weights, so we might do a combination of free weights with the resistance bands. We do actually give them a package of those resistance bands with the door anchor, and those come at different tensions. So we have a 10, 15, 20, even 30 pounds resistance, so they can do good amount of exercise. Also, they may be able to combine that with some other equipment, as I mentioned, like maybe they have weights at home. They want to use food cans. Maybe they're not strong enough, so that might be something to consider. You can do a squat with water jugs, and those can be also for upper body movement. So there are different ways that they can do their exercises. It's important that actually I share with them some resources, so they actually going to be able to perform these exercises at home. So I just wanted to mention one more thing about this program, that this is done once a week when we meet with them once a week. And then other days of the week, they exercise on their own. And then I review what they did for the week and give them feedback on their progression and encourage them to continue doing well. And if they may have some kind of a problem, maybe an injury, maybe pain in the joint, so we have to, we try to address it and figure out how do we work around it. So here are some examples of exercises that we do. So working on the back muscles, working specifically on that mid trapezius that is weak, and with bad posture, we tend to lean forward. So it's important really to open the chest area and strengthening those trapezius muscles. We want to work on the triceps so that you can see the anchor is at different heights. And that's also another piece that it's important for us to keep in mind, to allow them to work those different muscle groups. Also using the feet as an anchor. So they're doing bicep curls. They will be working on the glute muscle. So that's very, very important, working on the glute muscles. And that's an issue for many people because we tend to sit a lot. And I always say that those muscles are taking a nap for so many years. We got to wake them up. And it's really important. So they are very inhibited. And then a lot of them end up with tight hip flexors and some other issues that may come up over the years due to lack of activity. So we try to focus on glute activation in different ways, either standing, using a chair, doing a chair squat, also doing some exercises on a mat, a glute bridge, either with those Theraloop bands or even without, that's going to strengthen the gluteus medius that tend to be very weak among a lot of people. The dead bug is a great and safe exercise for many patients. So some of them who cannot go or do the exercise on a mat on the floor, I encourage them to do the exercise on their bed, on the firm part of the mattress. So there's no reason for them not to do these exercises, because these are the exercises that people are most intimidated by. They are not comfortable going on the floor and performing these exercises. But that's kind of, we figured a solution for that. All right. So another piece that is extremely important as part of the weight loss is making adjustments with medications. So as people do more of their exercise, they become more insulin sensitive. As we mentioned, there's glucose uptake increase by the muscles. So there's significant risk of hypoglycemia. And we know that those who take insulin, sulfonylureas, glitanides, those are the ones that are more risk to drop. So part of our program, we have a nurse that make the adjustments with their meds. So cutting down their insulin, either the rapid acting or the long acting insulin. Maybe on days that they exercise, they may not be taking their sulfonylureas, and the days that they do not, they will be taking it. But over time, as they become more insulin sensitive, they will be cutting down all of these meds. And then we have these group of meds that there's less risk of getting hypoglycemia. So it's important for them to check their glucose. A lot of people have a CGM, either a Libre or a Dexcom, so they can see and track their glucose while they're exercise. And that's also part of their motivation to continue exercising, because they see the improvement in their glucose over time. So lastly is measuring body composition. So that's really important. So body composition refer to the breakdown of the body weight, so muscle mass, body fat, body water. So just stepping on a scale, on a regular scale doesn't give us the information that we want to look for, because we want to see, okay, what is the weight, what amount of muscle mass they have, and what about the body fat, because we want their body fat to decrease while maintaining their muscle mass to keep their metabolism up, because we know part of weight loss, people tend to lose also their muscle mass, and then their metabolism slow down, and they're not able to lose as much weight, and makes it more challenging for them, and they get really aggravated by it. So they cut down their calories even more, and then they get into that vicious cycle that it's not working, and they get really frustrated about it. So part of the answer is really having them step on a scale that measure the body composition, see that they decrease mostly body fat. We want them to preserve, as I said, preserve their muscle mass, and as they progress with their exercise routine. So we also measure, as I mentioned before, waist and hip circumference. That's another way for them to see those changes in their body, and part of that success. Okay, so now we're going to get into the summary. So I think exercise is a key component in weight loss. We definitely need to increase the awareness about sarcopenia and the role of resistance training. We want to address those barriers that our patients have, and figure out some solutions. How do we keep them active? And I guess part of the answer is break down the exercise routine, so it doesn't feel really intimidated to do minutes in a row, an hour a day, where you can actually fit it in short bouts throughout the day. I found that it's even working for me great when it's a busy day and I cannot get all my exercise. Then I break it down to 3 slots for the day. We definitely want to figure out ways to encourage them to increase intensity. So that's a piece that they tend to maybe work at a steady pace, comfortable pace, but we have to push them a little bit to challenge them at somewhat comfort level, in a way that that's where interval training can work great for them, because they work hard for maybe a few seconds, maybe it will be 30 seconds, and then they will bring it down to like a light to moderate intensity, and then they're going to push themselves again. So this is a great way to slowly increase the threshold. We definitely want to provide them some resources. I think I was in the other slides talking about resources like YouTube and exercise apps, so they can actually follow that routine that we do, and it's easy for them to implement whenever they would like to. It's important to adjust their meds, again, to prevent that hypoglycemia, because we know if they're dropping low, they're more likely they have to treat it. That means they're consuming additional calories, and that may not be within their caloric intake for the day. So that's where a key to cut those meds, and especially that we know some of the meds makes it more challenging to lose weight or may cause weight gain, like insulin. So we want to also offer maybe a group or more individualized exercise session so they can actually learn those exercises. So if there's a way that you can work with exercise physiologists or maybe a physical therapist in the hospital and the clinic where you work with, or you might even connect with a health club in your area and you refer your patients there so they will be able to learn how to do their exercises, and you have someone that you can talk to and figure out how their progression is. So using a body composition scale that give us a breakdown of body fat, muscle mass is better than just a regular scale. Taking the waist and hip measurement to track changes is also important. And lastly, which it wasn't part of this topic, is really working with a nutrition educator to get that proper meal plan to help with preserving muscle mass or increase muscle mass and reduce body fat, which is essential with the weight loss. Okay, so I'm going to stop right here. Thank you for your time.
Thank you. Thank you so much, Dr. Jacqueline. And please do join us for the panel discussion, which will be about an hour and 15 minutes later to take the questions. Yes.
Sure.
Thank you so much.
Okay.
Yes.
All right. You're welcome. Thank you.